Good morning. Good morning. My name is Beverly Alves, and on October the 4th, 2006, my husband Joe and I received a phone call that changed our lives forever. We were told a CAT scan had found a mass on Joe's pancreas. This is our story. Joe was a remarkable and complex man. Intellectually, Joe was brilliant. He was honest and kind-hearted. Joe was a good son, a good neighbor, and a great teacher. To me, Joe was my true love. Physically, Joe was healthy. During the summer of 2006, he developed a backache. Against my wifely advice, he had moved by himself a large part of a tree that had fallen in the road. He was concerned someone would drive into it. Immediately, he developed a backache. He had also developed some mild GERD. After 6 weeks, I finally got him to see a doctor. We and the doctor thought it was a pulled muscle, but the backache didn't go away. A doctor friend of ours encouraged us to see a gastroenterologist. The gastroenterologist also thought Joe merely had a pulled muscle, but because he was a specialist, he decided to do some tests. The CAT scan revealed the mass. From the moment we learned of the mass to the day that Joe passed on, we were confronted and confounded by a medical system that was uncoordinated and unable to deal effectively with what became Joe's excruciating pain, our anxiety, stress, and impending loss. I don't believe that anyone caused Joe's passing. I accept it was his time. But if there had been a comprehensive plan in place with specified criteria, which would have indicated if and when Joe needed services, it would have done a lot to help us deal more effectively with the overwhelming crisis of Joe's illness and his impending death. These are some of the problems we encountered. The gastroenterologist said his office would set up an appointment for Joe to have a pancreas and liver biopsy, but they didn't schedule the biopsies in a timely manner. I had to repeatedly call the doctor's office begging and pleading for them to schedule the biopsies. It took nearly 3 weeks to get a biopsy. Joe was in substantial pain by that time, and we were both very anxious. It was horrible. While waiting for the biopsies, in desperation, I began looking for an oncologist. A man I knew recommended his. However, this doctor's manner was so dehumanizing that when we left his office, it was as if we were already dead. He silently read the reports of Joe's MRI and CAT scans in front of us, making faces of horror. Then he gave Joe a cursory exam, left him sitting on the examination table, and turned to me. Looking in my eyes, he said, "No hope." Joe was sitting just a few feet away. No matter what I said or asked, this doctor had something negative to say in reply. Without hope, there is no life. All this time, Joe was in pain. Because we didn't have an oncologist, our family doctor was writing emergency scripts, which had to be refilled every 48 hours. I watched my husband counting out pills to see if he would have enough to last for 48 hours, knowing he needed a higher dose. The tumor was pressing on a nerve in his back, but being afraid to take more, lest he run out before we could get the next script filled. Living in the country, at times it was difficult getting to the pharmacy in near winter. It was a true nightmare. Finally, Joe was scheduled for a pancreas and liver biopsy, but the surgeon didn't biopsy Joe's liver. I ran down the hall after the doctor to find out why, but I was intercepted by a nurse. No one seemed to understand or care. A few days later, when the gastroenterologist called to give us the results of the biopsy, I told the doctor to tell Joe whatever he needed to tell him, but not to take away his hope. The doctor said, "The results of the biopsy are not good. You need an oncologist." Then he hung up. He never referred us to an oncologist or gave Joe meds for his intense pain. He just hung up. We were left on our own to get Joe the care he needed. I had been networking. A friend called to tell us the name of a surgeon at Albany Med. I called the doctor to make an appointment. The doctor was available, but I had to plead for 3 days to get an appointment with him because the scheduler was out. No one at the hospital would pick up a pencil and schedule an appointment until the third day when I began to sob. We saw the surgeon 2 days later. The surgeon asked, "Where is the liver biopsy?" He said they couldn't determine what to do for Joe without a liver biopsy. It was more than 2 weeks after the pancreas biopsy that Joe finally had a liver biopsy. The biopsy indicated the cancer was in Joe's liver. The surgeon arranged for us to meet with an oncologist. As soon as Joe learned he had inoperable metastatic pancreatic cancer, he volunteered to do clinical trials. He wanted to do this not only to help himself, but to help make things better for mankind. The oncologist said he would fight this with us together. We left the hospital that day with our heads held high, with hope in our hearts. The next week was Thanksgiving. We had one of the nicest Thanksgivings we had ever had because we had some hope. Unfortunately, during Thanksgiving weekend, Joe's cancer produced thrombotic clots, which caused him to have a stroke. There were no neurologists in our rural Fulton County. The ER doctor frantically called neurologists from other areas, but his calls were not returned. We sat in the emergency room all night and watched as Joe became paralyzed. He was unable to move his left side. Gratefully, his cognition was not affected. He even took a book to the emergency room with him. Finally, around 5 a.m., Joe was rushed to Albany Med. The people who worked at Albany Med were caring and dedicated, but there was no system to coordinate care there. The analogy I use is it should have been a ballet. Instead, there were a whole bunch of great ballroom dancers. Albany Med did not have a palliative care program. It is now 8.5 years later, and AMC still doesn't have a palliative care program in their adult hospital. Thankfully, however, I heard they will be starting a program soon. Joe was a wonderful patient. He did his best to help those who were helping him. He was stoic, but his pain was monumental, frequently hovering around 8 or 9, even being off the charts. One night, Joe's pain was so intense that he asked for more meds repeatedly. I told the floor nurse this numerous times. Finally, Joe's pain became so intense, he started to weep. My heart broke, and I wept along with him. When the nurse came into his room and saw us both weeping, she worriedly asked, "What is going on?" Joe said, "We are sharing sorrow." The nurse was nearly brought to tears herself. She told us she had made repeated requests to the pharmacy for his meds through email and voicemail. She said there was no one to speak with directly in the pharmacy, even if it's an emergency. Finally, Joe got his meds. The next night, I saw another patient, a young woman, a little more than a girl, in the same plight. She was standing by the nurse's station, weeping, begging, pleading for pain medication. This is unacceptable. It is inhumane. Along with his intense pain, Joe had a lot of anxiety, yet he was never referred to a pain management specialist or given adequate anxiety meds. No one should have to be in that much pain and anxiety in a hospital. Shortly after Joe passed, a psychiatrist told me that in a living will, in addition to requesting that you want meds to reduce pain and suffering, you should also stipulate that you want meds to reduce anxiety, as the dying process itself can produce anxiety. A week before Joe passed, he looked very ill. In the morning, I asked the oncologist liaison if Joe needed hospice. She said no. No one says he has 6 months or less to live. I was incredulous. In the evening of that very same day, however, the hospitalist, a very caring doctor, worriedly told me, "Bev, Joe is not going to make it through the night." I was aghast. Nothing major had happened during the day. It was just different interpretations of Joe's condition made by different people because there was no coordination of care. The hospitalist thoughtfully placed Joe in a small single room. Staff asked me for directions regarding end-of-life decisions. We had submitted a living will, but no one could find it. Watching your loved one die is a terrifying and agonizing experience. It is one thing sitting safely in your attorney's office making out a living will, and another to confront the impending loss of your beloved. I knew Joe had signed a DNR, but at that point, I was nearly stuporous. I asked to speak with the hospital's ethicist for direction. He gave me good advice, but it would have been better if he had spoken with me in person. We discussed this by phone. When a patient is dying, family members are in crisis too and also need support. I was alone. The ethicist told me to ask Joe, in case something happens during the night, what do you want me to do? Joe was exhausted and in great pain. He didn't want to discuss anything. I specifically asked him, do you want to be on a ventilator? He said no. I gave staff this information. Unfortunately, there was another breakdown in communication. At 3 a.m., a young resident came into Joe's room, woke us up, and started to discuss ventilation and resuscitation. Although Joe and I were both educated people, neither one of us understood what he was saying. We were extremely disoriented and became more fearful. In fact, after the resident spoke to him, Joe said, do everything, which was contrary to the directives in his living will. I was frantic. I spoke with the nurse on duty about how this had happened. She said she had called the resident. She said she could see how ill Joe was and feared he'd be put on a ventilator. No one had written down Joe's verbal DNR. Joe never got back to sleep that night. Around 6 a.m., he said, the odds are not in my favor. This courageous man who hardly ever complained now felt defeated. He became very fearful. He said, I am facing death. I was beside myself. Fortunately, just at that moment, I recalled the book my rabbi had given me. The book is Why Me by Pesach Krauss, a chaplain at Sloan Kettering. I remembered that Rabbi Krauss said when he spoke with patients who were very ill and fearful, he would ask this question, what do you want to do with the time you have left? So I asked Joe this. Joe, being Joe, said, I want to enjoy myself. I asked him, how would you do that? He said, I want to go home. I told Joe's oncologist this, but no one from the hospital helped me make any plans. No one. Instead, the same doctor who had told us less than a month before that he would be a partner with us said, Joe is no longer strong. You need to take him out of the hospital, put him in a nursing home. I could still remember, and probably always will, my knees starting to buckle under me when he told me this. I felt like he was just tossing Joe away. I was desperate. A friend told me there was a new hospice in our county. My plan was to place Joe in hospice for a few days until I could connect with a home health care planner. The day before Joe was to be transferred there, a wonderful hospice nurse came to see him. She saw how badly Joe was suffering. She saw that AMC staff didn't know what meds Joe needed to ease his pain. She asked staff to start him on the meds he would be receiving in hospice. Thankfully, they did. Joe's pain finally subsided. He was able to relax. Before Joe and I started on this journey, he said he would do everything he could to get better, and he did. He asked me only one question. He asked me what I would do if he couldn't go on anymore. I told him I would let him go. When the time came, with much pain and deep sorrow, I did. The next morning when I was in the bathroom in Joe's room, Joe quietly passed to the other side. I think he purposely waited till then to spare me further pain. I took solace knowing that at least Joe was now at peace. These are just some of the many incidents that caused Joe to endure needless and severe pain and anguish. Palliative care would have gone a long way in helping to ease Joe's suffering and my grief at seeing it. Joe was grateful for all the help people had given him, for all the thoughts and prayers people had sent our way. On December 18th, 22 days after Joe entered Albany Med, and only 31 days after being formally diagnosed, this remarkable man passed from this world, leaving us his legacy of courage, dignity, devotion, and love. Fortunately, before Joe passed, we were able to tell each other we knew we were the right partners for each other. Joe told me I was the queen of his heart. He was the king of mine. I feel blessed that we were able to hold on to each other and cherish the time we had left, in spite of his terrible illness and the problems we encountered. But it could have gone the other way because of things that did and did not happen during Joe's illness. The last few days of a person's life are the most important. There may not be time for a second chance to straighten things out. As badly as I still feel by Joe's passing, I would feel much worse if things had not been good between us when he passed. Joe was not angry, and I don't feel guilty. After Joe passed, I asked friends what they would want to be told if they had a serious or life-threatening illness. Our friend George said it best. He said he would want to be told, "You're very sick, but we're going to do everything we can to help you." Many medical professionals are bright and filled with essential medical knowledge, but totally unaware. Some need training in human relations. They need to learn to speak to a patient and the patient's family and loved ones with compassion. I have come here today to share this with you. Patients are human beings with hopes, dreams, fears, and sorrows. They are people who have thoughts and feelings. They are not simply an accumulation of cells, organs, and systems. To treat only a disease or an injury is to be merely a body mechanic. When speaking with a patient, especially one who is critically ill, pause, take a breath, think, listen, or pray if you do. Treat patients and their family members the way you would want to be treated, the way you would want your family members to be treated. Be a partner with your patient in their healing. Listen to them. Studies show that people heal better when they have a support system. Be part of that support system, because even if you can't cure your patient, it will make all the difference in the time they have left. Then you will truly be healers. I thank you for giving me this opportunity to tell Joe's and my story. I believe he's here with us today in spirit. We need a humane healthcare system which provides compassion, support, and medical equality for all. Thank you.